fundamental to having a sustainable NHS in the future is making sure that the patient voice is in the room at the same time as the clinical voice and the same time as the commissioning voice.
This event is the start of something big, new and transformational for health and social care in this country.
It's talking to patients themselves that's the critical thing, and to be able to do so in an environment where the patients aren't just talking to us, they're talking to each other, and instilling in us a sort of consensus view about where we're failing.
I think it's really important for people to be involved in the design and delivery of services, and so that those decisions are going to be taken with the voices of patients ringing in their ears rather than just briefings and papers and evidence.
I feel it's important that NHS England involves patients and the public in decisions because they are the service users, and if you want to create services that are used well, cost effective, then consult the people that are actually using them.
I'm here today because I collaborated with our homeless and asylum seeker patients in Leeds. Together we improved accessibility to the services by getting them online so they could book appointments online, access benefits and housing information online, and also get back in touch with friends and family that they'd lost contact with.
Once you have a partnership with patient and provider, I think that then that's when you can master a better quality of care.
I'm here today to represent the views of young people. Young people want to see change and want to work collaboratively with the NHS to see an improvement in our healthcare, and I'm here to ensure that their voices are heard and not forgotten.
We find many people from BME communities who are, their needs are not met, have little access to psychological therapies, have more medication, are restrained more, are locked up more, and we want a service which is responsive to their needs.
The NHS needs to create the best cultures for staff and the best care for patients.
The reason I want to be involved in events like this is because I'm able to get my view as a young person and other young people's views across to the NHS.
We're here to listen. As a board, we're listening to citizens, and we're hoping, as citizens ourselves, to be able to participate in an active conversation so that when we go back and sit as a board, we're actually taking in all the influences and all the really critical issues that we've heard during the course of this exchange.
We don't want endless talk about patient engagement. We don't want to be consulted. We want to be listened to. And I'm not sure that our conveners expected quite such a challenging group, but I hope that they will listen to it and they'll take it away.
We'll know by the end of the day how far we've got towards solution, which is what all of this is about.
I just really hope that we're listened to and that we're fed back to, and that the things that people have asked for are progress.